Hi there, this is Mrs. Rusnak. Today I'm going to show you how to do taking a rectal temperature. First thing I'm going to do is I'm going to go ahead and sanitize my hands, rub this all over, make sure it's dry, and then I'm going to go ahead and get my supplies. So I'm going to go ahead and get a thermometer. You can use an old-fashioned traditional thermometer, but many people don't have these in hospital facilities or nursing homes or long-term facilities anymore. If you do come across one of these, if you're doing a rectal temp, you want to stick with the color red with that. Green or blue is for your oral, for your mouth, and red is for your rectal. You're also going to need a little bit of lubricant. You can also use an electronic thermometer, which is what most people use today. So we're going to go ahead and use an electric thermometer. I will tell you that if you use the old-fashioned thermometer, when you remove this out of the case, you want to go ahead and you want to shake. I can't get that one out, so you want to go ahead and take this out and shake this down so that the blue line reads at the bottom of the thermometer before you take the temperature. But we're going to go ahead and use the electric thermometer. So I'm going to go ahead and grab that. I'm going to grab a tube of lubricant and a cover for the thermometer, an alcohol wipe or two, and a recording sheet. I'm going to go into the resident's room and introduce myself. Hi, Mr. Wallace. My name is Amy. I'm going to go ahead, your STNA, I'm going to go ahead and take your temperature rectally. Is that okay? I'm going to go ahead and make sure that it is the resident that I think it is, and it is Mr. Wallace. All right, the next thing I'm going to do is, this is going to be kind of embarrassing for him, so I'm going to make sure that I pull the privacy drape. I'm also going to make sure that I put on gloves and lock the bed. And I'm going to raise the bed up to thigh-high level. So in order to be safe, I'm going to go ahead and pull this side rail because I'm going to turn him that way. I'm going to then raise the bed up. Bring the covers off of him, trying to keep him as covered as possible. I'm going to go ahead and turn him over to the side. I may have to pull him this way and then turn him so his face and doesn't go into the side rail and he's not on his arm and that type of thing. This is a mannequin, so they're a little bit more difficult to keep over on this side. I'm going to go ahead and try to kind of keep them there. All right, the next thing I'm going to do is I'm going to go ahead and take out my electronic thermometer. These come with little sheaths that go over them. You stick that down where the arrow is, and then you peel up the front and the back. Then I'm going to apply a tiny bit of lubricant, and a little bit goes a long way. You do not need a lot of this, okay? I'm going to then go ahead and spread his buttocks. And I'm going to go ahead and insert this thermometer about 1/2 inch to 1 inch into the rectum. You don't want to force it in. If you feel something stopping you, you do not want to go any further than that. So I'm going to go ahead and then I cover the thermometer, but I keep my hand on the thermometer, but I cover it with a blanket or a sheet until if I have an old-fashioned thermometer, it's going to be about 3 to 5 minutes. If it's an electronic thermometer, I'm just going to wait for it to beep, okay? We're going to pretend like it beeped. We're going to go ahead and remove it from the resident, replace the blanket over him, keep him over on his side. I'm going to go ahead, excuse me, and take a tissue, and I'm going to pull this sheath off and dispose of this. And I'm going to go ahead and look at the thermometer right away, because if I go wash my hands and I take care of the resident at this point, then I look at the thermometer, that temperature is going to go down. So I want to make a mental note of what that temperature is right now. I'm going to go ahead and take an alcohol wipe and clean this off. And then I'm going to put this back into the case. If it was a traditional thermometer, I would go ahead and take it to the sink and wash it with warm water and then clean it. The next thing I'm going to do is I'm going to go ahead and remove my gloves. And then I would go to the sink and wash my hands. Once I have my hands washed, and by the way, I wouldn't have walked away from this bed with it up like this if I went to wash my hands. We're gonna pretend like I go wash my hands. I'm gonna come back, and then I'm gonna help the resident onto his back. All right, Mr. Wallace, we're gonna help you back onto your back. I'm gonna make sure that everything's put back into place. I'm gonna make sure that he has his call light. I'm gonna lower his bed. I'm gonna make sure that I clean up all my supplies, throw everything away that needs to be thrown away. Okay, and then I'm gonna just make sure I take everything with me. I'm gonna pull back the curtain. Put the side rail down. Mr. Wallace, do you need anything else? He's gonna tell me no. If you need anything, just give us a call on your call light, okay? And he's gonna tell me okay. I'm then gonna go ahead and I'm gonna record his temperature on the recording sheet. And then we're ready to go. And if there's any problem with the temperature and it's too low or too high, you wanna report that to the nurse. Thank you.